Hello, my name is Nicole Manley, and I'm doing this video for my poster project for improving psychiatric screening in the correctional setting. I started out by just listing a couple of the facts to describe the clinical nursing problem. And to begin, we do have ineffective and inadequate mental health screening, which is an ongoing problem in the United States, especially within the correctional setting. The rate of mental illness within the inmate population is 3 times greater in men and 2 times greater in women than it is in the general population. Um, Identifying inmates with mental illness has proven to be poor at best, meaning we're not getting the numbers that we should be getting. The only way to begin treating these individuals is to better identify the individual. Some of the background, I did go over some research, and went over a qualitative study that suggested that of the 3,492 prisoners, only 25% of those were assessed, and 13 were accepted by the mental health institution. Um, Better medication compliance was proven when inmates were continued on previously prescribed medications. And also, all studies addressed that the issue of access to mental health services is poor. Educating staff on effective screening tools will increase identification of inmates with serious mental illness. And there were 4 different tools that were studied and proven to be the most effective. The first one is the brief jail mental health service screen. Excuse me. Also, the mental health screen. I focused mine on men because the institution that I was focusing on was a male institution. In my project, I did all staff members from the High Desert Correctional State Prison of Nevada were invited to come to a brief presentation. It was on the necessity to improve the current screening procedures for all incoming prisoners. The presentation included a brief introduction on the problem with statistics and mental health. The staff members were educated on the current research in the area showing its significance, and finally 2 screening tools were introduced and proven to be the most effective. That was the brief jail mental health screen and the mental health screen for men. There were a couple statistics between both of those screening tools that I pointed out. Both of them require less than 5 minutes. The BJMHS, that screening tool has 8 yes or no answers, whereas the mental health screen, that has 12 yes or no answers. Statistically, they were both about the same in sensitivity. The mental health screen did beat out the brief jail mental health screen, just shy of anywhere from 17 to 12 points. Both of them can be used by correctional staff as well as medical staff. And I did point out that there's criteria to be met. Some require 1 yes answer and some require 2 yes answers depending upon which screening tool you're using, as well as the fact that if you have any unanswered questions, the inmate refuses to answer questions, he's not sure of the answers, you're able to document that as well instead of saying a yes or a no. And then, as always, as a clinician, you're able to refer inmates over to mental health if you feel that there's any reason that they should be referred over. Unfortunately, due to the timing, my project did only get 10 team members in attendance, and then we had 1 director of nursing, 2 charge nurses, and then the rest were staff members. The time frame between my approval of completing my project as well as actually doing my project was quite short, so that's something that I would look at in the future if I was going to redo this. Also, I did find it would have been beneficial to have some correctional staff members with me. I was all nursing and they were all clinicians. I wasn't able to get any of the providers to come in, which was unfortunate. But the warden, administrators, the associate wardens, caseworkers, those would all be beneficial in having them come to a presentation like this where we do want to implement a new policy. Some of the concerns from the staff, actually the main concern from staff is the lack of psychiatric staffing, meaning that we do not have enough psychiatric providers to be able to actually see these many individuals. The last thing I just touched on was just briefly on the fact that we do need to improve access to mental health. We do need to appropriately prescribe psychiatric medications, improving mental health staff by screening, health by screening and assessment of the past SMIs, and in the correctional institution, just overly improving the whole process will help with nursing practice as a whole. And that's all I have for you. Thank you.